Dr. Heather here today, and we're going to talk about IT band syndrome. A lot of you guys have talked about complaining about some type of knee pain, but wasn't really sure or weren't really sure if it was your IT band getting involved. So what I want to do now is really kind of address the IT band and why it's known as the most second common injury for knees, especially in runners. So first of all, guys, as you know, if you haven't subscribed to the channel, please go ahead and do hit subscribe. And if you're finding content of value, if you're finding any of the content of true value, please go ahead and give the like button a nice little hit because that's always appreciated. And if you are a current subscriber, thanks for always listening. And I'm hoping that you always find value in the videos that I put together. So as you guys always know, I like to bring out my friend, Mr. Super Skeleton here, because we want to really understand why that IT band might be getting involved and how we can go ahead and look at really working on some stretches, some soft tissue work, some exercises to really keep that IT band from being involved. But first, let's kind of go over the anatomy and figure out where is my IT band. Okay, so over here we have our femur, okay? That's that main thigh bone that we all like to see some nice muscular development on. So right here, if we come off to the very kind of outside of the hip bone itself, okay, this little bony prominence is known as the greater trochanter. We come all the way down here, essentially to the lateral epicondyle of the femur, right as we cross it. And as you guys can see, I'm going to bend the guy a little bit for you all to see. And we come right here. This is the fibular head right here. The IT band actually attaches itself right to that fibular head, right over here. So a lot of times our IT band is made up of some friction that we're feeling between the femur and the tibia that's putting some strain right there on the most lateral and outside and most distal part of our IT band, because the IT band runs that whole length of that femur right here. But a lot of times we normally don't feel any pain or discomfort until we kind of hit mid-level, if not all the way down part of the knee. Now, just so you guys know as well, there's also another strip, a band of tissue that's up here that comes off the ilium and then attaches itself right here really to the greater trochanter, and that's known as your TFL. And this can also kind of get really tight too if that IT band is getting irritated as well. So right off the bat, this is where we want to start addressing kind of our pain symptoms and looking at breaking down the tissue. A lot of times our IT band does come on as we're starting to do the activity, especially like I said in runners, as that foot's striking the ground, that's when that IT band is going to feel its most kind of irritation, and then it can just become a stinging, nagging kind of pain on the outside part of that knee. Now, usually with an IT band issue, there's never really any swelling going on. So if there is some swelling, it may really not be your IT band. The IT band could be getting involved, but it may actually also be something else that we'll address in some other videos. Now, if you guys aren't sure if it's your IT band or runner's knee, just so you know, there's going to be another video that's going to talk about the two and how to distinguish between one versus the other. So do pay attention to that video as well. So like I said, as we're talking about this IT band, we first want to address some soft tissue, and that's what we're going to do first. We're going to look at addressing some soft tissue by using a foam roller. Okay, so like I said, we're going to talk about our IT band and what we can do to really help that injury in successfully healing. The first thing we want to do, like I mentioned, is we want to start with the soft tissue first. So I have my foam roller here. We're going to take it, we're going to place it down on the ground, and we're going to come down onto our hip. So the first part, like I said in the office, is we do want to address the TFL first. That first group of tissue that's on the side, we want to start there and then go all the way down the IT band, all the way down to that fibular head. So we're going to come down, lay on it. Now for a lot of people, just laying on the roller, if your IT band is that sensitive, is going to be very uncomfortable, and you really may just want to hang out here and not even start rolling. So from here, I like to actually put both arms a little bit more forward onto the ground, because like Spider-Man, we're going to be walking ourselves up towards the other end of the room. I'm going to lift my lower leg up, again intensifying it a little bit more. But what I'm going to do is, as you can see, I'm rolling all the way up, all the way down my leg, just like that. All right? And so what we would want to do is, we want to address it at least 10 times. Then we have two IT bands. Just because one side is injured doesn't mean we shouldn't address the other side. So do come over to the opposite side, get those hands in front, and then go ahead, roll it all the way out, and come all the way back. So that's step one. You do want to make sure that you're working the soft tissue first. And as you can see from my helper, he's making sure I do it correctly. So from there, we want to look at doing some stretches to our IT band. Now, how do we go about doing that? Well, there are some classic ways to stretch out your IT band, and we're going to go through those now. Now, the more classic way to stretch out an IT band would be to put the hand against the wall, stagger the feet, and then you drop that hip in towards the wall, trying to stretch out that leg. Sometimes this one can be felt, sometimes it can't. So what again you would do is stand here, come here against the wall, cross the leg, and then what you're trying to do is just drop that body in and really stretching out that leg there. But again, it's a hard one to do. The other one you could do is trying with a TRX. So you go ahead, take the TRX up nice and high, drop the hips down, then stagger the feet, bending that front leg and going ahead and really dropping that hip there. Again, a lot of times you'll only feel the top part of that TFL being stretched, not necessarily that IT band. Now, the roller is going to be your best friend when working with IT band syndromes. Stretching it out, unless you have a partner that could actually really stretch out that leg when you're laying on a bench and dropping that leg behind, that's the only really way you're going to get a really decent stretch out of that IT band. Now, the other thing we want to address is how to really go about strengthening the leg so this way that IT band fully relaxes. Now, a lot of people talk about doing clamshells to go ahead and strengthen out the hip joint and everything when the IT band gets irritated. But here's my thought on it. Well, if I'm already externally rotated at the hips and my IT band is really tight, why would I do clamshells and bringing out my hips? Why wouldn't I want to address actually working a little bit more on adduction and working on making sure that my VMO and my gracilis, my adductors, and my VMO are all stronger to really balance out that tracking of the knee, allowing for less friction to happen at that femur and that tibia head. So how do we strengthen that VMO? I'm going to give you guys the most simple exercise and trick that you can do to start getting that to happen for you. So now we know you have a foam roller, so here's the trick to the exercise that you can do to start getting that VMO to start firing off. And by the way, little trick, if you have Suzanne Somers' Thigh Master, it's one of the only fitness tools that was ever invented in the 90s that actually does exactly what it's supposed to, which is strengthen that inner thigh. So ladies, honestly, if you still have that little fitness tool device, use it and your IT band issues will definitely disappear. Okay, so we're gonna go down and we're gonna recreate essentially like a Thigh Master exercise. So we're gonna come down onto the ground. We're gonna take our foam roller, simply place it in between our knees, hold and squeeze for 30 seconds. Just by doing this, we're gonna start setting off that VMO. Now, what you can do from there is you can go ahead and start bringing the legs straight up, squeezing here just as well. Now, another little trick is when you go ahead, bring the legs down like so, kicking back up, working the hamstring muscle and the VMO at the same time, allowing for that IT band bunch of tissues and that lateral vastus muscle to relax a little bit more while you're starting to strengthen the other two areas that are going to be a little weaker because that IT band is taking such brunt force when your foot is striking the ground. So there you have it. Those are some simple things you can do to help your IT band feel a lot less discomfort and start working on correcting some of those muscle firing patterns. So like I said, guys, start with the roller, build yourself up, and if you have questions or comments, drop them down below. If you found this video helpful, as always, give it a like. And if you haven't subscribed to the channel just yet, please do go ahead and subscribe. And if you have been watching some of my videos, thank you as always for watching. Hey guys, this is Dr. Heather. This is a little talk on IT bands and how to fix that problem. Stay tuned. I'm going to have another video out shortly discussing the difference between runner's knee and IT band because it is one of the most common questions I always get asked. All right, everyone, have a great day.